What if I told you that the difference between seniors who thrive well into their 90s and those who decline rapidly after 70 has nothing to do with genetics, expensive supplements, or even exercise routines? After 3 decades of working with thousands of patients, I've discovered something that will probably shock you. The secret isn't found in any medical textbook, and most doctors never discuss it with their patients. Yet it's one of the most powerful predictors of longevity, mental sharpness, and overall vitality in your golden years. I'm Dr. James, and I've spent over 30 years specializing in geriatric health, watching patterns that most medical professionals completely overlook. Today, I'm going to share with you a truth that might make you uncomfortable at first, but could literally add decades of vibrant living to your life. Before we dive in, if you're someone who believes that aging doesn't have to mean giving up on feeling truly alive, hit that subscribe button and ring the notification bell. Your future self will thank you for what you're about to learn. Now, let me ask you something. Have you ever noticed how some people in their 80s seem to have this inner glow, this spark of life that radiates from within, while others the same age appear to have simply given up? The difference isn't what you think. It's not about having more money, better healthcare, or even superior genetics. It's about something far more fundamental, something that connects to the very essence of what makes us human. You see, there's an epidemic happening right now among seniors, and it's not diabetes, heart disease, or even dementia. It's what I call the great disconnection. Millions of older adults are systematically cutting themselves off from one of the most powerful sources of health and vitality available to them. They're doing it because society has convinced them it's inappropriate, unnecessary, or impossible at their age. But the science tells us a completely different story. What I'm talking about is the deliberate abandonment of physical pleasure and intimate connection, including the relationship with one's own body. I know this might sound surprising, even uncomfortable to discuss, but bear with me because the research is absolutely clear. Seniors who maintain an active, healthy relationship with physical pleasure, including solo sexual expression, consistently show better cardiovascular health, stronger immune systems, improved cognitive function, and significantly lower rates of depression and anxiety. Let me paint you a picture of what typically happens. Someone reaches their 60s or 70s, maybe they've lost a spouse, or they've experienced some physical changes, or they've simply internalized the message that people their age should no longer be interested in such things. So they shut down that part of themselves. They tell themselves it doesn't matter anymore, that it's not appropriate, that they're too old. But here's what they don't realize is happening inside their bodies. When you stop engaging in regular sexual activity, whether with a partner or alone, your body begins a cascade of changes that affect far more than just your reproductive system. Blood flow to vital organs decreases. Hormone production starts to decline more rapidly than it would naturally. Neural pathways associated with pleasure and reward begin to weaken. Your sleep quality deteriorates. Your mood regulation becomes less stable. Even your immune system starts to function less effectively. This isn't speculation. This is documented medical science. Studies have shown that regular sexual activity, including masturbation, provides measurable health benefits that extend well into advanced age. We're talking about improved circulation, better hormone balance, enhanced mood regulation, stronger immune function, and even protection against certain types of cognitive decline. But the benefits go far beyond the physical. There's something profoundly important about maintaining a connection to your own body, to your own capacity for pleasure and intimacy. It's an affirmation of life itself. It's a way of saying, I am still here, I am still alive, I still matter. When seniors abandon this aspect of themselves, they often begin a gradual withdrawal from life in general. They become less social, less active, less engaged with the world around them. I've seen this pattern countless times in my practice. A patient will come to me complaining of fatigue, depression, sleep problems, or just a general sense that life has lost its color. When I explore their history, I often find that somewhere along the way, they stopped being intimate with themselves or others. They closed off that part of their humanity because they believed it was no longer relevant or appropriate. Now, I want to address the elephant in the room. Many of you are probably thinking, this is inappropriate, or people my age shouldn't be thinking about such things. These reactions are understandable because we've been conditioned by a society that has some very strange ideas about aging and sexuality. We're taught that physical pleasure is somehow the exclusive domain of the young, that there's an expiration date on our right to feel good in our own bodies. But think about this logically. Why would the human body maintain the capacity for sexual response throughout life if it wasn't meant to be used? Why would nature design us to continue producing hormones and maintaining sexual organs if they were supposed to become irrelevant after a certain birthday? The truth is, your body is designed to experience pleasure throughout your entire lifespan. The idea that this should stop at some arbitrary age is a social construct, not a biological reality. In fact, there are compelling reasons why sexual health becomes even more important as we age, not less. As we get older, we face natural declines in various bodily functions. Our circulation isn't as robust, our hormone levels drop, our muscle tone decreases, and our neurological function can slow down. Regular sexual activity, including self-stimulation, directly counteracts many of these age-related changes. When you engage in sexual activity, your heart rate increases, pumping blood more vigorously throughout your body. This improved circulation nourishes tissues that might otherwise begin to deteriorate. Your brain releases a cocktail of beneficial chemicals, including endorphins, oxytocin, and dopamine. These natural chemicals reduce stress, improve mood, enhance bonding, and even provide pain relief. Your body also experiences a modest increase in testosterone and other hormones that help maintain muscle mass, bone density, and overall vitality. Perhaps most importantly, sexual activity stimulates multiple regions of the brain simultaneously. Recent neuroscience research has shown that sexual pleasure activates areas of the brain associated with memory, learning, emotional regulation, and executive function. In essence, it keeps your brain young and flexible. This is why seniors who maintain active sex lives often show better cognitive function and lower rates of dementia. But let's be practical here. Many seniors face real challenges when it comes to sexual health. Physical changes, medication side effects, loss of partners, and emotional barriers can all make intimacy more difficult. This is where the power of self-care becomes particularly important. Masturbation requires no partner, can be adapted to physical limitations, and can be practiced in privacy at your own pace and comfort level. For many seniors, the idea of masturbation brings up feelings of shame or embarrassment. They may have grown up in an era when such topics were strictly taboo, when self-pleasure was considered sinful or harmful. But modern medicine tells us exactly the opposite. Masturbation is not only harmless, it's beneficial. It's a natural, healthy expression of your sexuality that can provide all the physical and mental health benefits I've described. The key is approaching it with the right mindset and technique. This isn't about trying to recapture your youth or perform like you did decades ago. It's about gently reconnecting with your body, rediscovering what feels good, and honoring your current needs and limitations. Your body has changed, and that's perfectly normal. What matters is that it's still capable of experiencing pleasure, comfort, and connection. So how do you begin this journey of reconnection? First, you need to create the right environment. This means setting aside time when you won't be interrupted, ensuring you're comfortable and warm, and approaching the experience with patience and self-compassion. There's no rush, no pressure to achieve any particular outcome. This is about exploration and rediscovery, not performance. Start by simply being present with your body. Take some deep breaths, let your muscles relax, and just notice how you feel. Many seniors are so disconnected from their physical sensations that this simple act of presence can be profound. You might discover tension you didn't know you were carrying, or areas of your body that feel numb or forgotten. Gentle touch is the next step. This doesn't have to be sexual initially. Simply explore your body with curiosity and kindness. Notice which areas are sensitive, which feel good when touched, which seem to have lost sensation. Remember, this is not about judgment or comparison to how things used to be. It's about accepting and appreciating what is. As you become more comfortable with touch, you can gradually explore more intimate areas. Use a high-quality lubricant if needed, as natural lubrication often decreases with age. Take your time, listen to your body, and stop if anything feels uncomfortable. The goal is not to achieve orgasm, though that may happen. The goal is to reconnect with pleasure, however subtle or intense it might be. Many seniors are surprised to discover that their capacity for pleasure hasn't disappeared. It's just changed. Sensations might be different, timing might be slower, but the fundamental ability to experience physical joy remains. Some find that they're actually more capable of deep, sustained pleasure than they were in their youth because they're less focused on performance and more present to the experience itself. It's important to address some common concerns that arise. First, many seniors worry that sexual activity might be dangerous given their health conditions. In most cases, the gentle, self-paced activity I'm describing is not only safe but beneficial. However, if you have serious cardiovascular issues or other medical concerns, it's always wise to discuss this with your healthcare provider. Another common worry is about privacy and dignity. You might wonder what family members would think or feel embarrassed about your needs and desires. Remember, this is your body and your health. You have every right to pursue activities that make you feel good and support your well-being. You don't need anyone's permission to take care of yourself. Some seniors also struggle with performance anxiety, worried that they won't be able to respond the way they used to. This is where changing your mindset becomes crucial. Success is not measured by how quickly or intensely you respond. Success is measured by how connected you feel to your own body, how much pleasure you're able to experience, and how much this practice contributes to your overall sense of well-being. Consistency is key to seeing benefits. Like any form of self-care, the positive effects accumulate over time. I typically recommend that seniors aim for sexual activity, whether with a partner or alone, 2 to 3 times per week. This doesn't have to be elaborate or time-consuming. Even brief sessions of intimate self-care can provide significant health benefits. As you develop this practice, you may notice improvements in other areas of your life. Many of my patients report better sleep, improved mood, increased energy, and even better relationships with others. There's something about honoring your own needs and pleasure that radiates outward, affecting how you move through the world. This journey of reconnection can also inspire other positive changes in your life. When you start treating your body with with more respect and care, you might find yourself making better food choices, being more active, or taking better care of your appearance. It's as if awakening one aspect of your vitality awakens others as well. I want to address one more important point. Some of you might be thinking, but I'm married, or I have a partner. Maintaining your own relationship with pleasure doesn't replace intimacy with others. It enhances it. When you're comfortable with your own body and sexuality, you bring more confidence and presence to shared intimate experiences. Many couples find that when both partners maintain their individual sexual health, their relationship benefits tremendously. For those who have lost partners, self-care becomes even more important. The grief and loneliness that often accompany such losses can be overwhelming. Maintaining a connection to pleasure and intimacy can be a powerful way of affirming that your life still has value, that you still deserve to feel good, that you're still fully alive. Let me share a story that illustrates the power of what we've been discussing. I had a patient, Margaret, who came to me at age 74 feeling completely defeated. She'd been widowed for 3 years and told me she felt like she was just waiting to die. She had no energy, couldn't sleep, and had lost interest in everything she used to enjoy. Her adult children were worried sick about her rapid decline. During our conversations, it became clear that Margaret had completely shut down her sexuality after her husband passed. She felt guilty even thinking about pleasure, believing it would somehow dishonor his memory. We worked together over several months, helping her understand that honoring her own vitality was actually the best way to honor the love they'd shared. The transformation was remarkable. As Margaret began to reconnect with her body and rediscover her capacity for pleasure, her entire demeanor changed. Her energy returned, her mood improved, and she started engaging with life again. She joined a hiking group, rekindled old friendships, and even began dating again 2 years later. Her children couldn't believe the change. Margaret herself said she felt like she'd been reborn. This story isn't unique. I've witnessed similar transformations countless times. There's something profound that happens when seniors reclaim their right to feel good in their own bodies. It's as if a switch gets flipped, awakening not just their sexuality, but their entire zest for life. Now, let's talk about some practical considerations that many seniors face. One of the biggest challenges is dealing with medications that can affect sexual function. Many common medications prescribed to older adults, including blood pressure medications, antidepressants, and antihistamines, can dampen sexual response. This doesn't mean you should stop taking necessary medications, but it does mean you might need to adjust your expectations and techniques. If you're dealing with medication-related side effects, communication with your healthcare provider is crucial. Sometimes dosages can be adjusted, or alternative medications might be available. In the meantime, focusing on sensual pleasure rather than performance can help you work around these challenges. Remember, the goal isn't to achieve a specific outcome, but to enjoy the journey of connection with your body. Physical changes also present real challenges. Arthritis might make certain positions uncomfortable. Decreased flexibility could limit movement. Reduced lubrication might cause discomfort. These are all normal parts of aging, and they don't have to end your intimate life. They just require adaptations. For joint pain and stiffness, timing can make a big difference. Many people find they have more mobility and less pain at certain times of day. Plan your intimate moments for when you feel your best. Warm baths or showers beforehand can help relax muscles and joints. Don't be afraid to use pillows for support or to try different positions that are more comfortable for your body. Lubrication becomes increasingly important with age, especially for women experiencing vaginal dryness due to hormonal changes. High-quality, long-lasting lubricants can make a tremendous difference in comfort and enjoyment. Don't view this as a failure or limitation. It's simply a tool that helps you take care of your body's changing needs. For men dealing with erectile dysfunction, remember that erection isn't necessary for pleasure or intimacy. The focus on performance that dominates younger sexuality often becomes a barrier for older adults. Learning to appreciate different types of touch and sensation can open up new avenues of pleasure that don't depend on specific physical responses. Mental and emotional barriers often prove more challenging than physical ones. Many seniors carry decades of shame, guilt, or misinformation about sexuality. Religious upbringing, cultural messages, or traumatic experiences might create internal conflicts about pursuing pleasure. Working through these barriers often requires patience, self-compassion, and sometimes professional support. Therapy can be incredibly valuable for seniors struggling with sexual issues. Sex therapists who specialize in working with older adults understand the unique challenges this population faces. They can provide practical strategies for overcoming physical limitations, as well as emotional support for working through psychological barriers. Support groups, either in person or online, can also be beneficial. Connecting with others who are navigating similar challenges helps normalize the experience and provides practical tips and emotional encouragement. Many seniors find great relief in discovering they're not alone in their struggles or desires. Let's also address the elephant in the room regarding technology and modern sexuality. The internet has created new opportunities for connection and exploration that didn't exist for previous generations of seniors. Online communities, educational resources, and even virtual intimate connections can provide outlets for those who might otherwise feel isolated or limited in their options. However, navigating navigating digital sexuality requires caution and wisdom. Online safety is crucial, especially for seniors who might be more vulnerable to scams or exploitation. Education about protecting personal information, recognizing red flags, and maintaining healthy boundaries is essential for anyone exploring online intimate connections. The beauty of reclaiming your sexuality in your senior years is that you bring wisdom, experience, and self-knowledge that younger people often lack. You're less likely to be driven by insecurity or the need to impress others. You can focus purely on what feels good, what brings you joy, and what enhances your well-being. Many seniors discover that their sexuality actually improves with age in some ways. Without the pressure of fertility concerns or the rushed intensity of younger years, intimate experiences can become more mindful, more connected, and ultimately more satisfying. You have the luxury of time, the benefit of experience, and the freedom that comes from caring less about what others think. This journey of sexual reclamation also ripples out into other areas of life in beautiful ways. Seniors who embrace their sexuality often report feeling more confident in social situations, more willing to try new experiences, and more open to forming new relationships. There's something about accepting and celebrating your own desires that makes you more attractive and engaging to others. The health benefits we discussed earlier also compound over time. Regular sexual activity helps maintain the use it or lose it principle that applies to so many aspects of aging. Just as physical exercise helps maintain muscle mass and bone density, sexual exercise helps maintain sexual function, hormone production, and overall vitality. Research has shown that sexually active seniors have lower rates of cardiovascular disease, stronger immune systems, and better cognitive function compared to their celibate peers. The stress-reducing effects of sexual pleasure contribute to better sleep, improved mood, and greater resilience in facing life's challenges. As we near the end of our time together, I want to emphasize that this isn't just about sexual health in isolation. It's about reclaiming your right to feel fully alive at any age. It's about rejecting the notion that aging means settling for less, feeling less, experiencing less. Your body is still your body. Your needs are still valid. Your pleasure still matters. The senior years can be a time of incredible freedom if you approach them with the right mindset. You've fulfilled many of your obligations to others. You've raised your children, built your career, contributed to society. Now is the time to focus on yourself, to explore what brings you joy and vitality. Reconnecting with your sexuality is just one aspect of this larger reclamation of your life. I've seen too many seniors resign themselves to a diminished existence because they believe that's what aging requires. They accept fatigue, depression, and disconnection as inevitable parts of getting older. But they're not inevitable. Much of what we attribute to aging is actually the result of neglecting our fundamental human needs for pleasure, connection, and intimacy. So here's my challenge to you. If what I've shared today resonates with you, if you feel a spark of recognition or hope, don't let it fade away. Take one small step toward reconnecting with your body. It might be as simple as taking a warm bath and really noticing how the water feels on your skin. It might be giving yourself a gentle massage. It might be setting aside some private time just to breathe and be present with yourself. Whatever step you choose, approach it with compassion and patience. Your body has carried you through decades of life. It deserves your respect, care, and attention. It deserves pleasure. And you deserve to feel fully alive for as long as you're drawing breath. Remember, age is not a disease. It's not a condition to be endured or a problem to be solved. It's simply another phase of life, one that can be rich with meaning, pleasure, and vitality if you approach it with the right tools and mindset. The secret I've shared with you today is just one of those tools, but it's a powerful one. Your story isn't over. Your capacity for growth, pleasure, and joy doesn't have an expiration date. You have every right to pursue what makes you feel good, what supports your health, and what honors the magnificent life you've lived and continue to live. The best years of your life don't have to be behind you. They can be right now, and they can extend far into the future. If this message has inspired you to think differently about aging and vitality, please share it with others who might benefit. And remember to subscribe and hit that notification bell so you don't miss future content designed to help you live your best life at any age. Until next time, honor yourself, care for yourself, and never forget that you deserve to thrive.